Okay, let's talk about pain. It's something we all feel at some point, right? But how we deal with it, well, that's the real story. Today, we're digging deeper than the usual quick fixes. We're asking a pretty important question. Is our go-to solution for pain really the best one for us? Let's get into it. Just think about it for a second. You get that throbbing headache after a crazy long day. Or maybe it's that nagging back pain that just won't quit. What's your first move? What's that automatic reaction to just make it stop? For a whole lot of us, the answer is waiting right there in the medicine cabinet. We reach for an over-the-counter painkiller. Why? Because it's fast, it's easy, and honestly, it just feels like a totally normal part of life. But here's the big question for today. What if that simple, totally normal habit isn't quite as harmless as we think? What if the very options we consider the safest are actually hiding some risks we've never even thought about? To really get why this is such a big deal, you just need to see this number: 100 million. That's how many people, just in the US, are dealing with chronic pain. We're not talking about a small fraction of people here. That's nearly a third of the population. And look, this goes way beyond just feeling uncomfortable. Research shows that chronic pain has this huge ripple effect. It impacts people's ability to work, their mental health, their entire quality of life. And it costs the economy a fortune. So the stakes for finding the right answers are incredibly high. You know, when we think about risky painkillers, our brains pretty much jump straight to opioids. We all know about the dangers of addiction. And because of that, we tend to think that over-the-counter drugs, like acetaminophen, are the totally safe alternative. But is that assumption really true? Well, this is where the story takes a pretty sharp turn. A huge study from the National Institutes of Health, the NIH, found something surprising. It turns out that high, long-term use of acetaminophen, which many of us know as the main ingredient in Tylenol, was linked to a nearly doubled risk of certain blood cancers. Now that is a finding that really makes you rethink what safe means. And let's get a little more specific here, because the details matter. For certain cancers that affect the bone marrow, they're called myeloid neoplasms. The risk was actually more than doubled. And for non-Hodgkin's lymphomas, which affect your body's lymphatic system, the risk was almost twice as high. So these aren't just vague suggestions. They're real statistically significant findings that we need to pay attention to. Okay, so if our most common automatic choice has these potential risks, what are the other options? This is where we need to shift our thinking, away from a single magic pill and towards building a whole toolkit of different solutions. Let's start with the first drawer in that toolkit: other medications. So this first layer of our toolkit includes other types of drugs. You've got your anti-inflammatories or NSAIDs like ibuprofen, but it also includes things you might not expect, like certain antidepressants or even anticonvulsants. They were made for other things, but doctors discovered they can be really good at calming down nerve-related pain. But, and this is a really big but, it's not as simple as just swapping one pill for another. As major medical reviews have shown, the evidence for how well these work can be really mixed, and it all depends on the specific condition. For something like chronic low back pain, for example, the results are often kind of all over the place. This is the perfect example of why a one-on-one conversation with your doctor is so critical to figure out what could actually work for you. All right, let's open the next drawer in our toolkit. Because sometimes the best approach isn't a pill that floods your whole system, but something much more targeted. A medical intervention that goes right to the source of the problem. These are basically procedures a doctor can do to deliver treatment with pinpoint accuracy. So instead of a pill, you might get a corticosteroid injection that reduces inflammation right inside an arthritic knee, or an epidural that gets medicine to the exact nerve root that's causing that sciatica. You can even get trigger point injections to release those super tight, knotted up muscles. It's all about precision. And now for the really cool, kind of sci-fi part of our toolkit, using technology to manage pain, sometimes without any drugs at all. We're talking about some pretty incredible stuff here. For instance, there's radiofrequency ablation, which uses heat from a tiny electric current to basically turn off a specific nerve that's sending out pain signals. Then you have spinal cord stimulators. Think of them like a pacemaker, but for pain. It's a small device that gets implanted and uses these mild electrical pulses to just scramble the pain signals before they can even get to your brain. A less invasive version of this is a TENS unit, which does a similar thing with little electrodes you stick on your skin. And what's so powerful about these technologies is that they can be a total game changer for people with really specific, stubborn pain conditions, the kind of stuff that just hasn't responded to other treatments. For them, these options can offer real, significant relief, completely drug-free. So we have this amazing toolkit, right? We've got different medications, targeted interventions, and all this high-tech gear. But the real secret, the most effective approach, isn't just about picking one tool. It's about shifting our entire mindset, from finding the right pill to building the right plan. The framework that guides this new way of thinking has a bit of a fancy name. It's called the biopsychosocial model. I know, it sounds like a mouthful, but the idea behind it is actually incredibly simple. It just means that to treat pain effectively, you have to look at the whole person, not just the part that hurts. You can basically break this down into 3 pillars. First, you have the bio part. That's your body, the physical source of the pain. Then you have the psycho part. That's your mind, your thoughts, things like stress, anxiety, and how you mentally cope with pain. And finally, you have the social part, your life circumstances, like your job, your relationships, and your support system. All 3 of these are tangled together and affect how you experience pain. So, here's the bottom line. The goal is to create a plan that's personalized just for you, and that's multimodal, which just means it uses a combination of tools from our toolkit. Maybe that's physical therapy, plus a non-opioid medication, plus some stress management techniques. And crucially, it's a plan you build with your doctor, through shared decision-making, not one that's just handed to you. All right, so let's boil it all down. What are the big things to take away from this? First, chronic pain is a huge problem. Second, even our most common, safe painkillers might have serious long-term risks we didn't know about. Third, there is a massive toolkit of alternatives out there. And maybe the most important takeaway of all, the best strategy is a personalized plan that treats the whole you, not just your symptoms. And that leaves us with one final thought. The next time you feel that ache or that pain starting up, before you automatically reach for that pill, just pause and ask yourself this question. Am I trying to treat the real problem here, or am I just trying to mask the symptom? The answer to that could honestly change everything about how you manage your health.